Thank you for joining me here at the live desk. I am Janae Hancock. Cardiac arrest has been the topic of a lot of conversations lately after Damar Hamlin, Buffalo Bills player Damar Hamlin, collapsed during a live televised football game at the beginning of this year. And then also LeBron James' son, Bronny James, he collapsed during a basketball practice at USC on Monday. He is now recovering after being admitted to ICU. And I do want to turn to Twitter with that being said, taking a look at this tweet from LeBron James just moments ago, saying, "I want to thank the countless people sending my family love and prayers. We feel you, and I'm so grateful. Everyone doing great. We have our family together, safe and healthy, and we feel your love. We'll have more to say when we're ready, but I wanted to tell everyone how much your support has meant to all of us." Again, that tweet is coming from LeBron James. And with all of this being said, I do want to turn things over to, let's see here, our Zoom call that we have going on right now. We are actually joined by Dr. Lindsey Malloy Walton. She is a physician in the Children's Mercy Heart Center. Dr. Lindsey, I want to thank you so much for joining me here at the live desk. I want to start off with a basic question here. What is cardiac arrest?
Well, thank you so much for having me today to talk about this. This is my passion and my true love, why I do my job every day. Cardiac arrest is when the heart stops beating and you can't get adequate blood flow and perfusion to all the organs in your brain that you would normally need. And although uncommon, it can be very emotionally disturbing when an event like this happens.
Right. And so, we hear a lot about cardiac arrest. We also hear a lot about heart attacks, maybe in older adults. Can you just talk a little bit about the difference, if there even is one? What is a heart attack?
Yeah, so a heart attack is also when there's abnormal beating potentially of the heart and not good oxygen and circulation to the heart, but it can be transient. So you may have symptoms and then they resolve. A heart attack can lead to a cardiac arrest, but a cardiac arrest is when the heart really stops beating effectively and it can be much, much more serious.
Yeah, and these conversations around cardiac arrest have been very interesting. I have been learning a lot myself. So basically, during a cardiac arrest, you basically die within that moment. Is that correct?
That is correct. Yeah, you don't have effective blood flow to your organs and your heart stops beating. And if it is beating, it's not effective beating. It can be an abnormal heart rhythm and it doesn't perfuse your brain appropriately.
And I brought up Bronny James, LeBron James' son, who is, just starting off his career playing for USC. I know that he is a very talented player. A lot of eyes have been on him. How common is this among young people suffering from cardiac arrest?
Yeah, that's a very good question. We certainly see it more commonly in young athletes, specifically males and African American males and even basketball players. But having said that, we can see this in a school setting. We can see this out at recess. We can see it in a pool. We can see it anywhere. It's common. It's more common than people may think. About 200 children will die a year from a sudden cardiac arrest event. So it's not insignificant.
And you also mentioned that statistically it is common among young Black people, or Black people in general, I should say. Why is that?
I don't think we really know. I do think we do see this more commonly in our athletes and specifically basketball players, but I don't think we really know why.
Did also mention that Bronny James, he is currently recovering after being admitted to the ICU on Monday. How common is that for a young person or just anyone in general to be able to recover from a cardiac arrest?
Yeah, so obviously this story continues to develop, and I'm so thankful to hear that he's doing so well and that he's out of the ICU and recovering.
Right.
Unfortunately, events like this occur, and not everybody has as good of an outcome as he's had. But I think because of the awareness now with Bronny James and Damar Hamlin, people understand that there needs to be a response and a recognition of these events. And so luckily in these two instances, this was recognized quickly, help was called for, CPR, effective CPR was started really quickly, and there was an AED and it was used. And I think this concept of being able to do all of these things really saves lives.
Right. And so unfortunately, that's not the situation. That's not the case for everyone to just have a team. They're available to attend to them when situations like this happen regarding cardiac arrest. What does the recovery process look like for a lot of people that suffer from cardiac arrest?
Yeah, that can vary. In our adolescent and pediatric population, luckily, kids are pretty resilient and they do very well after events for the most part. If they get effective CPR and they get effective AED resuscitation quickly, we know out of hospital, events typically lead to death. But if we have effective CPR and effective AED use, that's very minimal in terms of what that death rate may look like. So patients who come into us, typically come in. Sometimes they have breathing machines. Sometimes they're on medications. Sometimes they come in and they're sort of back to their baseline. It totally varies. But really crucial is the resuscitation efforts that occur right away in terms of how the outcomes are for them in the future.
I mentioned that there are a lot of eyes on Bronny James. He
Yeah.
is the son of LeBron James, but we have an intern here, and I just learned yesterday that she suffered from a cardiac arrest years ago, but she was told that she'll never be able to play volleyball again. Do you think that that will be the case for Bronny James or any other young athletes who unfortunately have a cardiac arrest?
Yeah, I think that, this is a really, really crucial question in our day to day. So typically, patients have a cardiac arrest because they have a structural heart disease, something that they were born with. Sometimes it can be a genetic arrhythmia syndrome, an abnormal heart rhythm that can lead to a sudden cardiac arrest. And sometimes we just don't know. We do a big workup, a big evaluation on patients like this. We try to figure out a cause. If we can figure out a cause, and we can, offset that with medications or therapies, then sometimes patients are able to return back to play or to sports. Sometimes we don't know the etiology of the event or what caused it. And that sometimes delays their ability to go back. But typically, we want people to be able to do what they are passionate about and what they love. But having said that, we want to make sure they're safe first and protect them ensure they don't have another event, or if they do, we have all the protective mechanisms in place to make sure that they survive that event.
Right, and Dr. Lindsey, right now we are taking a look at a video that we received yesterday of NFL player Damar Hamlin returning to football practice for the first time since collapsing on the football field at the beginning of this year. What can parents and coaches do to prevent cardiac arrest from happening, if anything?
Yeah, so I think this is a really good question, right? We all worry about our kids and our teenagers and how do we prevent this and can we prevent this? And the answer is sort of, right? There are pre-participation screenings for physicals to play in sports. There's AHA and NCAA guidelines that talk about, getting a good history, getting a good family history, really delving into those things, getting a good exam, making sure that there's nothing obviously concerning. So all, athletes should get pre-participation physicals. The problem is that we often don't see anything abnormal, and then this happens. So while I think it's important to get the pre-participation physical, know that this still can happen. Having an awareness and understanding what to do should an event happen is really, really important.
Right, and so we do have a lot of kids that are playing outside these days in the excessive heat, and they're getting ready to play those outdoor sports, or they're already doing it right now. Can the heat at all trigger any heart problems among these kids, or maybe even adults that are walking around or running outside right now?
Yes, I know these 100-degree days are hot.
Extreme.
Yeah, there are some specific arrhythmia syndromes that are triggered by heat. And so we have seen that with specific patients where they've had an arrest event while they've been running out, on the track field during school, and they get overheated and they have an arrest event because they had an underlying problem that was triggered by that. It's rare, but it can happen, right? You're much more likely to have heat exhaustion or syncope or dehydration. But again, in these extreme, temperatures, it's always good to take caution, take breaks, stay in the shade, and drink lots of water and be well hydrated.
Right, and so you talked about also saving lives and making sure that, you have people that are there that are able to step in if you do have a cardiac arrest or maybe a heart attack or anything of that nature. I do want to talk about and shift gears here. Let's talk about Project Adam. I know Children's Mercy is doing a lot within schools to get out there and make sure people have the knowledge of CPR. Tell us a little bit more about that. And I know you have someone there with you that can join in and let us know what Project Adam is.
Yes, so Project Adam is a national organization that helps bring awareness and emergency responsiveness planning to schools, specifically should a cardiac arrest happen in a school. You know, our call to action is that all people learn CPR, especially in our schools where our kids are. Should an event happen, we are ready with a plan of what to do, who to call, who does CPR, how to use the AED, where the AED is, and you know, sort of the follow-up after an event like this were to happen. We have started Project Adam here locally in Kansas City, and we've been able to get several schools heart certified, meaning that they have, you know, provided that they can perform activities that prevent or respond to a cardiac arrest and are heart safe. And we encourage all schools in Kansas City to become Project Adam heart certified, ensuring that people know how to perform CPR and know where the AED is and how to use it should there be an arrest in a school setting, whether that's during the school hours or after hours.
Yeah.
We want to make sure that kids are protected.
And I know, school students are preparing to go back to school, and teachers are preparing to welcome them back. So this is very significant right now, but extremely throughout, or especially throughout the school year. Is this a problem? I know you said you all are just now bringing this into Kansas City schools. Is this a problem that you guys are seeing within our local schools right now? Are they having to use these CPR systems a lot?
Yeah, so we just kind of looked at our data for the last year, and we've had 5 sudden cardiac arrests in the Kansas City and the neighboring region that have, you know, ended up with care here. And there's obviously some events that didn't get to us or didn't have as great of an outcome and didn't come to us. But we do see it. So in a year, we've had 5 children with an event. So it does happen. And certainly when it happens, we want people to feel prepared.
Yeah, and it is extremely important that people are prepared for any situation. One last time before I let you go, Dr. Lindsey, if you can just touch on again how important it is to you that people out there, especially our viewers right now, get CPR certified, or they consider it at least.
Yeah, you know, I think these events that we see nationally are a call to action for us. For all of us to learn CPR, to help each other. Should somebody have a cardiac arrest, it shouldn't matter who you are or where the event happens. You should be able to have adequate chance at surviving, right? So knowing CPR, knowing how to call for help, and engaging in this, and you know, having the knowledge of where an AED may be located, and how to access that, and actually feeling like you can utilize that, right? There's barriers to doing it and then actually, or saying you're going to do it and then actually doing it, right? Like I think people have to know that patients are, in these instances, like you said before, are not alive. And so you can do no harm, right? I think it's our call to step in to provide adequate resuscitation to these folks as part of who we are as a society and a community. And I ask that the Kansas City community do this and step up and help each other.
Yeah. Well, Dr. Lindsey, I do appreciate your time to sit down and talk to me about cardiac arrest, what it is, and what our community needs to know, because it is important that people know how to respond, like you just touched on. Again, I am Janae Hancock here at the Live Desk, and this is an ongoing conversation, as we just heard about Bronny James, the son of LeBron James. He did collapse during a basketball practice at USC. Again, his career is just getting started, and a lot of eyes have been on him, as well as the topic of cardiac arrest. So we will continue to bring you all the latest developments. We just heard from LeBron James and their family. They're just thanking everyone for their prayers and continued support. As always, we will continue to keep you all updated. Right now, I am going to leave you all with this important video of students learning CPR, and also head on over to childrensmercy.com to learn more about their Project Adam, exactly what it is and how you can get involved.